Hello, I'm Peter Ndora. Welcome to this week's edition of Health Talk. And coming up on the program today, Health Talk producer Wandile Mofokeng speaks to two young women who were diagnosed with the inflammatory disease called lupus. And that sees the body's immune system attacking its own tissues. These women then went on to contract COVID-19. After that, the founder of the Lupus Drive NGO joins us to talk about the organization's support for people who suffer from the sometimes debilitating flare-ups of lupus. And then a rheumatologist at Helen Joseph Hospital in Johannesburg also talks to us about lupus, particularly its impact around COVID-19 and what it may do for them living with this condition. And a little bit later on, one of our regular features, we get advice from a general practitioner who answers questions about COVID-19 raised by patients on social media, especially with dealing with COVID-19 symptoms. Okay, so let's start with the show, and our senior producer, Zama Buthelezi, will take us through the latest South African COVID-19 numbers. Always good to talk to you. For a long time, the graph was doing this, but it seems to have plateaued and maybe even started to pick up a bit more.
A very good morning to you, Peter, and our viewers. Well, we are seeing an increase in the numbers. South Africa is now 10th when it comes to global infections in terms of coronavirus cases. At number 1 is the United States, recording more than 7.7 million infections. At number 2 is India, recording more than 6.7 million infections. Brazil recording more than 4.9 infections. Number 4 is Russia, recording more than 1.2 million infections. Colombia at number 5, recording more than 860,000 infections. Spain at number 6, recording more than 860,000 infections also. Peru at number 7, recording more than 830,000 infections. Argentina at number 8, recording more than 820,000 infections. At number 9 is Mexico, recording more than 790,000 infections, overtaking South Africa now at number 10. In the African continent, South Africa is leading with infections approaching the 700 mark. Let's take a look at the national COVID-19 statistics. More than 4.3 million tests have been processed in South Africa. More than 680,000 people have tested positive since the beginning of the pandemic in March. More than 600,000 people have recovered from the virus, but sadly, more than 17,000 people have succumbed to the virus. Looking at the infections in the provinces, yes, the numbers of infections are increasing and decreasing somewhere, but 4 of the 9 provinces are still reporting the highest numbers of infections, and these are provinces with big metros. Gauteng is still the epicenter of this pandemic. Let's take a look at these numbers. More than 220,000 people have tested positive in Gauteng. This province saw a 6% increase on the first week of level 1. More than 120,000 people have tested positive in KwaZulu-Natal. More than 110,000 people have tested positive in the Western Cape, and more than 90,000 people have tested positive in the Eastern Cape. While it looks like the following provinces are recording the lowest numbers compared to provinces with big metros, the rate of infection is slowly picking up. Let's take a look at where they are. More than 49,000 people have tested positive in the Free State. More than 30,000 people have tested positive in the Northwest. More than 27,000 people have tested positive in Mpumalanga. More than 18,000 people have tested positive in the Northern Cape. And more than 16,000 people have tested positive in Limpopo. Just an update on the US President Donald Trump after he and First Lady tested positive for COVID-19. He checked out of hospital on Monday just after 4 days of emergency treatment for the virus, pulling off his mask the moment he reached the White House and vowing to quickly getting back on his campaign trail. Great news, a vaccine against COVID-19 may be ready by the end of 2020. The head of the World Health Organization said this week while advocating investment in fighting against the pandemic. He was speaking at the end of a two-day meeting of the organization's 34-member executive board. We are now on level 1 of the lockdown regulations, and more sectors of the economy are now opened and children are back at school. This doesn't mean, though, that there is no more COVID-19. We need now more than ever to take extra care, South Africans. Let's continue to regularly wash our hands with soap and sanitizer. Let's use sanitizers containing 70% alcohol content. We must continue to wear a cloth mask that covers both our nose and mouth every time we leave our homes. We must also continue to practice social distancing and ensure proper ventilation indoors, especially as more people are back at work. Yes, some borders are now open, but we must continue to limit our travel to only that which is absolutely necessary. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you so much, and back to you, Peter.
All right, so level 1, but it does mean that we've got to be even more vigilant now than before, hey? And this is our gold now. This is our weapon number 1.
Especially as we are seeing the numbers slowly going up.
We've got to be
we
careful.
need to be more careful.
All right, so wear a mask, everyone. It's really, really important. This thing's going to save your life. Okay, so those statistics, the Zama, thanks so much indeed, always keeping us on top of those. But remember, as we observe and report on these COVID-19 cases, the numbers can change, sometimes significantly, as you've been seeing for the past 6 months. Right, that's the numbers, but let's focus now a little bit on the program and what's coming up ahead. Remember, you can also be part of the show, asking our guests some of the questions that you might have on your mind. Simply share your views maybe about the issues that we're discussing. The number to call is 011 714 5861 or 5877. That's 011 714 5861 or 5877. We'd love to hear from you, so please dial and share your thoughts with us. Now, every day, more than 5 million people worldwide are struggling with the often debilitating health consequences of lupus, a potentially fatal autoimmune disease capable of damaging virtually any part of the body. So the question that we're asking you today is, are you living with lupus, and how has the COVID-19 pandemic impacted your life? Please send us your voice notes or your video messages on our WhatsApp number, and that's 065 862 4548. 065 862 4548. Try and keep your messages just under 30 seconds so that we can share as many of those messages as we can. You can also share your thoughts with us, of course, on social media, and you can use our Twitter handle at SABC Health Talk or hashtag SABC Health Talk. And we're also on Facebook, and there just search SABC Health Talk. We look forward to hearing from you. Health Talk continues right after the break. Stay with us. Welcome back. You're still watching Health Talk. Now, from the beginning of the outbreak, the COVID-19 coronavirus pandemic has been an extra concern for people with the autoimmune disease, lupus. People with lupus are at higher risks of infection, and those with lupus who develop COVID-19 may also be at higher risk of developing severe symptoms. Sipe and Buitumelo were both diagnosed with lupus and later contracted COVID-19. Thankfully, though, they've both since recovered from the coronavirus. They shared their story with Health Talk producer Wandile Mofokeng.
Life with lupus can be difficult at times, particularly during a pandemic. Ntabo from the Western Cape has been living with lupus since 2010 when she was 21 years old. During that time, information about lupus was scarce.
With all the tests that they've done, they were trying to diagnose me with what I have. But through the test, I didn't have any other chronic illnesses. So when they did the kidney biopsy, they eventually found out what I have, which is called lupus SLE.
Could you maybe also briefly tell us about your symptoms?
Joint pains, loss of weight. That's it. Those are the three main symptoms, and chest pains. That's it.
Diagnosing lupus needs a high index of suspicion. Spear also struggled to get a diagnosis from a GP.
Many doctors don't know that lupus. They don't know what lupus is, and they have that sense that they must diagnose you with other chronic diseases, and it takes long for the doctors to diagnose lupus.
27-year-old Boitumelo Kobane was recently diagnosed with lupus, and she believes it might have been passed on to her from her family.
In my household, I'm not the only one who has it. My mother also has it, but hers is worse than mine. So the journey has been it has been quite challenging.
Also tell us about your symptoms and also the type of lupus you were diagnosed with.
Okay, so I have SLE lupus. So that kind of lupus is systemic, meaning that it attacks your entire body. So the tissues, so it really likes to play around with the kidneys, the bladder, the eyes, the brain, the heart, the stomach, the lungs, any kind of tissue, any healthy tissue.
How did the diagnosis or finding out that you're living with lupus impacted your day-to-day living?
Once you get diagnosed, everything about your lifestyle needs to change. So essentially the way you eat, even the way you exercise has to change. So I was told that I can't do running, for example. I would have to walk, because running would put a strain on my joints and make it even more painful.
Were you cautious of or maybe expecting to get COVID-19, seeing that your immune system is already battling? So talk to us about COVID-19.
I was very vigilant in terms of the social distancing, making sure that my surroundings are clean, only going out when necessary, going out, I think, twice a month to go and buy essentials. I'm working from home, so I did not really expect to get the virus.
I believe you also contracted COVID-19. Could you just kindly take us through that journey?
So I'm asking myself, how have I contracted this? Because I've been keeping to the regulations, the rules, and not going out except for necessities. So, and then I'm like, okay, let me just accept it and then just do what the doctor tells me,
Boitumelo and Spey are living proof that you can control your symptoms, prevent lupus flares, and cope with the challenges of lupus.
Every day, more than 5 million people worldwide are struggling with this debilitating health consequences of lupus, a potentially fatal autoimmune disease capable of damaging virtually any part of the body, as we've just been seeing in that package there just now. The question that we're asking you today is, are you living with lupus, and how has COVID-19, the pandemic, impacted on you? Please send us your voice notes or video call us on 065 862 4548. 065 862 4548. You can also share your thoughts with us on social media using the Twitter handle at SABC Health Talk. After the break, we speak to the founder of the NGO, the Lupus Drive. Find out what they do and how they're helping those that are dealing with lupus. Welcome back, and we continue with our focus on lupus. Now, this is a chronic, complex autoimmune disease that affects millions of people worldwide. More than 90% of people with lupus are women, and most of whom are diagnosed between the ages of 15 to 44. In this part of the program, we're in conversation with Pontso Moiloa, who's the founder of the Lupus Drive, which is a non-profit organization that aims to be a strong and common voice on behalf of people living with lupus. Very good morning to you, Pontso. Welcome to the program, and a purple day to you.
Good morning, Peter.
All right. So you started this organization, I think, 2017. What inspired that?
The organization was established 2017, the 25th of November, after a very close childhood friend of mine was diagnosed with lupus, He basically motivated the Lupus Drive, and we sat and actually did some research around what lupus was, because we got to realize that there's a lot that's not known in regards to the condition. So we started the drive together, and we're here till today.
All right. So what have you been trying to do? What's your main work?
So at the Lupus Drive, we basically try and create awareness around the condition lupus. We try and create a community for the warriors, because it is a condition that a lot of people don't know about. So we try and actually be a home to all lupus warriors in order for them not to feel isolated, because there's a lot of challenges that comes with having the lupus, having the condition itself.
And I guess awareness is a big thing, isn't it? And I mean, diagnosing it as well, as we've been hearing, is not that easy. So I'm just thinking, people in far out places, rural areas, they probably slip through the cracks.
Not only rural areas, urban areas as well. That's how bad it is.
Wow.
The education system really needs to try more in regards to putting lupus as a condition out there. We only have 100, the last time I checked, we had 100 rheumatologists in the whole of South Africa. So I guess it really goes back to the education and health system in regards to putting information about lupus as a condition, because people only learn about it from the time that they're diagnosed.
So the warriors that have joined the Lupus Drive, what kind of support and help are they asking for mostly?
Well, it really begins with basics, learning about the condition itself. What is lupus? How do I live with lupus? How do I communicate this condition to my family? Because you get scenarios or incidents where people get divorces because spouses don't really understand or know how to deal with the condition itself. So there's a lot that actually goes down to being a part of our lupus community, because then we get to go to families and actually explain more to their families about the condition, try and actually teach and educate the warriors about the condition, because on a daily, there's a lot that they deal with. For example, there's something called flare-ups, especially with the weather changes right now. So we basically get to educate themselves, the GPs, as to how to handle lupus warriors and their families, and going out to communities across the whole of South Africa in regards to creating the awareness itself.
And it being an autoimmune condition, COVID-19 is not a great thing. How has your work been impacted by COVID-19?
We had planned a lot of activities for the year throughout. We actually sat down with the Minister of Education, and we had scheduled going out to communities like FET colleges and universities across South Africa to actually create the needed awareness. And we were not capable of doing any of that because due to COVID-19 and social distancing and having to be safe and cleared really impacted us, because we're really, apart from social media, which is Twitter, Facebook, and Instagram, and in our lupus community group on WhatsApp. That was basically what we were able to do. We were not able to move around and actually do what's supposed to be done, because this is something that's not only neglected, but a lot needs to be put out there in regards to information on lupus.
I know that, as we've been saying, that the people that are members of your community are known as warriors, and it does talk to fighting. And I guess sometimes it can be mentally exhausting, and I suppose that that's one area that you have to deal with as well, just to keep people up, because as the flare-ups come, it can be quite a lot.
Yes, it is. They are truly fighters. I don't know of anyone that can deal with what lupus warriors are actually dealing with, because this is something that attacks your immune system. This is something that is capable of making all of your organs collapse at the same time. If not one, it can decide to make 2 organs collapse. It can decide to damage your brain, and they always recover. They always recover from this. So they are truly warriors, because and they are such positive people. I've never met a group of such positive people. They are just living their lives to conquer.
All right.
And
how can people become and join and get help from the Lupus Drive? Where do they go?
So we are on all social media platforms: Facebook as the Lupus Drive, Twitter as Drive Lupus, and on Instagram. And again, we have our small community, which is a WhatsApp group that we have our numbers on all our social media pages. If people want to join or need assistance with anything, they can simply just go there.
Pontso Moiloa, thank you so much indeed for joining us, and well done on setting this foundation up and the work that you continue to do. And I wish you and all your warriors the very best. Thanks so much.
Thank you so much for having us.
Thank you.
Thank you.
All right, that's Pontso Moiloa, who's the founder of the Lupus Drive, talking to us about the important work that her NGO is doing, helping those people with lupus. All right, let's take a look at some of the messages that have been coming through on social media. We've got a couple of tweets, and the first one is from Lolo, who says, you could never fight lupus if your mental health isn't in the right state. If you have friends and family members who have recently been diagnosed with lupus, I'm here to tell you that they aren't alone. We have support groups. Thanks so much indeed for pointing that out, a lupus advocate there. Lupus in colour. Now, to lupus warriors reading this, I know that you're tired and fed up with the pain. I know that you're close to breaking and you want to give up. There is a strength inside you that cannot be removed, a power deep in your soul. That's a beautiful message of encouragement. Thank you so much. And Lauren Brenneman says, found out that my lupus diagnosis wasn't accurate and that I'm having more issues with my liver. My meds are not helping as well, and my body's inflammation markers are up again. I pray that I can finish out this school year without sickness. Not sure what's going on, but God does. And Teboho says, it's been relatively easy to follow the social distancing rules because I have always practiced these rules because of my compromised immune system. I can add that it has caused anxiety, especially when I have to go out in public to work. Teboho, thanks so much indeed for sharing your message with us. And we've also been getting some messages on WhatsApp, and Chochua says the need to have more awareness about lupus, maybe the #1 undiagnosed killer. All right, okay, thanks so much indeed for sharing your thoughts with us and your messages. And yeah, we'll continue to explore this. After the break, in fact, we continue our focus on this autoimmune disease, lupus, as we speak to Dr. Marylyn Reddy, who's a rheumatologist from the Helen Joseph Hospital in Johannesburg. Stay with us for that. Welcome back. You're still watching Health Talk. Now, many people are unfamiliar with autoimmune disease lupus. There are several different kinds of lupus, each with slightly different triggers and symptoms. And it's a chronic disease that can cause inflammation and pain in any part of your body. Well, to help us understand the condition a bit more and what it means, particularly during a pandemic such as COVID-19, I'm now joined by Dr. Marylyn Reddy, who's a rheumatologist from Helen Joseph Hospital in Johannesburg. Thanks so much indeed for joining us, and welcome to the program.
Hi, Peter, and hi to our viewers. Thank you so much for having me on the talk show.
All right, so let's chat a little bit about lupus. Let's define a little bit. I mean, from what I was reading, there's a whole spectrum that falls in this lupus diagnosis.
Yes, absolutely. So with regards to the full medical term, it's actually called systemic lupus erythematosus, quite a lot to digest. So we abbreviate it as SLE and commonly refer to it as lupus. So we know that it's a very complex and chronic autoimmune condition, and it can present in many different ways with many organ involvement as well. So it's what we call multi-system involvement.
All right, so percentage of people that have lupus, I think we heard a little bit earlier on, 1 in 6, is that about right?
Well, I think it depends on the population group. Unfortunately, there's not many stats for South Africa. But look, I mean, across the autoimmune condition, it is one of the more common autoimmune conditions. So we know in general, autoimmune conditions are not that prevalent. You know, when you look at conditions like diabetes and hypertension and infectious conditions, we're not sitting as high as those conditions, yeah.
And then I believe that it affects more women and particularly women of color. Do we know why?
So there is a definite predilection for women. Male to female ratio is something in the order of about 10:1. So for 10 females that will be affected, there will usually be 1 male affected. And what is postulated is that amongst all the other risk factors, with regards to female, there may be a hormonal component.
All right, so there's no cure, right? And it's really about managing the symptoms.
Yes, unfortunately. So, you know, patients must be assessed appropriately. There should be adequate and appropriate medical therapy. Due to the nature of the disease being very unpredictable, you know, and we're unable to, there is no cure for lupus. But look, with appropriate treatment, patients can have a good lifestyle. Obviously, prognosis is also affected by the extent of disease. So we find that patients with lupus can present with a different, you know, they can have mild disease, they can have moderate, or they can have severe life-threatening disease. So all those, you know, the way a patient presents needs to be taken into consideration and appropriate treatment instituted. They need to be monitored and followed up with a rheumatologist.
All right, and typically, do we know ages of onset and how do you diagnose?
Yes, so with regards to age of onset, it mainly affects women of childbearing age. So usually in the category of 15 to 45 years of age. With regards to diagnosis, diagnosis can usually be a challenge in these patients. As we're saying, it's a very complicated and complex disease to have. And patients can present with a constellation of different signs and symptoms. So unfortunately, you find that there's usually a delay in diagnosis. With regards to diagnosing a patient though, what we would do as a rheumatologist, we would look at the clinical features, what the patient is presenting with. And there's several different organ involvements, which I can go through if you'd like me to. We also look at laboratory parameters. So urine analysis becomes important. Blood test becomes important. Patients can develop a lot of different blood abnormalities. where they have low cell counts, low platelet counts, and these are quite important in the diagnosis. Additionally, you can have antibodies that are positive. There's several different antibodies. The one that's quite well known of is the anti-nuclear antibody. And this is positive in most patients with lupus. But what's interesting is that the ANA can also be positive in other conditions, and a positive ANA does not always mean that you have lupus.
Is there, I don't know, typical kind of symptoms that should say, you know what, maybe this is a little bit more than just a sore joint, I need to go and get it checked out?
Sure. So I think if we're having joint symptoms, there may be early morning stiffness, there may be joint swelling as well. So, and usually the company that it keeps, if there's additional features, you know, that patients can present with lots of different rashes. The one that's most well described is the malar rash. And it's usually a telltale sign. It's called a butterfly rash as well. And that's because of the distribution of the rash. It goes over the facial area, the cheeks, as well as the nose. There may be other symptoms like lots of pain, fatigue. Patients may have unexplained fever, you know, and sometimes these conditions can be misdiagnosed, you know, as just an infection. But obviously, you know, in some patients, it may become a slow, insidious course or process. In other patients, there may be rapid evolution of lots of different signs. Even the neurological system can be involved. You know, patients can just present with headaches. There can be meningitis, stroke. There's so many different neurological involvement. There can be other organ involvement like the heart and the lungs. The kidney is quite commonly affected as well, what we call lupus nephritis. And with lupus nephritis, you know, there's inflammation in the kidneys, and patients can develop high blood pressure. They can develop kidney failure, even to a point of needing dialysis. So there's so many different features that patients can present with. Sometimes they may just have a clot, and the doctor may not, you know, realize that this is part of lupus, together with either antiphospholipid or not, you know, which is another syndrome that's additionally seen in patients with lupus. So I think there's constellation of signs and symptoms, and these may not all occur at the same time. You know, they may take time to come across, and as patients go, you know, through clinicians, eventually it gets put together with blood parameters that, okay, this patient has features of lupus.
All right, let's talk about day-to-day living. They talk about flare-ups. So it sounds as if that there's periods of calm and then flares, something triggers, you have a flare-up, and this is what you manage with your kind of medications and so on and so forth. How often between flare-ups, or does it vary from person to person?
So flare-ups can vary from person to person. If the patient is managed from with regards to their lupus and they're well controlled, then some patients may not have any flare-ups. They may be in a low disease activity state or even remission. In other patients, however, they may follow a chronic course where they may have intermittent flare-ups from time to time. And obviously, you know, one needs to contain inflammation, because when the inflammation is not contained, there can be organ involvement and destruction. And then this jeopardizes ultimately the function of that organ system.
And again, it can affect any organ, is that right?
Yes, yes. So lupus can affect any organ. So more mild disease would be skin and joint involvement, but more significant organ involvement, as I mentioned, can be the central nervous system, the heart, the lungs, the kidney, the gut. Unfortunately, there is no organ that's spared in lupus.
So it deals with immunity. So COVID-19 has complicated issues for people living with lupus. What challenges are you facing with COVID-19 and lupus patients?
I think initially at the start of the pandemic, as a rheumatologist, we were very worried because we know that we have patients that are immunosuppressed, both from the condition and from the treatment that we offer them. The good thing is that most of our patients are well informed in general because they usually practice good hygiene measures. So with COVID coming in, we anticipated that our patients will be sick, they're going to contract COVID, and they may be at risk for complicated COVID. But I must say, being on the floor and treating COVID patients during this pandemic, we have not seen an influx of patients coming in with autoimmune conditions and lupus. I think patients with lupus, their risk is probably that of the general population, from my experience and what I've seen at hospital.
All right. So as somebody that's managing this condition for many patients, is it getting better and better, the medicine that helps people with lupus?
I think there are newer treatments in the market. Lupus has evolved with regards to, we have expanded our knowledge and understanding of the condition, and thereby treatment has evolved as well. Plasmaquine is an anti-malarial, and that's one of the backbone therapy to any patient with lupus, unless there's a contraindication. Okay. In more severe organ involvement, we use a drug called cyclophosphamide, and this is chemotherapy in essence. It's given as an intravenous drug, and it has improved outcome in patients with severe organ involvement, together with additional therapies. There are also oral therapies, for example, like methotrexate and azathioprine, and these have all improved outcome in a lupus patient. Obviously, one would have to look at disease extent. We're dealing with mild to moderate disease. The outcome is usually quite good. With regards to severe disease, however, these can be life-threatening for patients. We know that the mortality rate amongst our patients unfortunately exceeds that of the general population. And this is usually because they have a heightened cardiovascular risk. There's usually more comorbidities on board, like diabetes and hypertension. And patients can die from, organ involvement, as well as infection, because we know their infection risk is higher.
All right. I mean, there must be a lot of people now who are feeling a little bit overwhelmed by the information that we shared, but I get a sense that, if you get diagnosed and managed properly, this is something that can be managed and you can live a fairly good life.
Absolutely. So I think if treated appropriately, and we have patients that are being educated about their disease, patients can lead almost a normal lifestyle. They can be near normal, near healthy, and they can work. And all these have contributed to patients being empowered as well with more knowledge about lupus.
Dr. Marylyn Reddy, we're going to have to leave it there. Thanks so much indeed for sharing your knowledge with us today on this condition. Thank you so much for your time.
Pleasure.
All right, that's rheumatologist Dr. Marylyn Reddy speaking to us. She works at the Helen Joseph Hospital. All right, let's take a look at some messages that have been coming through. And the first one is from Vuyokazi, who says, it's been an anxious filled time. I'm a healthcare professional and this has been very scary. I'm always wearing my mask, sanitize and wash my hands regularly, and I've just been diligent about hygiene. Thanks for sharing your message with us, Vuyokazi. And a WhatsApp message here says, good morning, my name is Mariam Steras. I'm battling with lupus 14 years now. And what a roller coaster drive it's been for all my fellow lupis. Remember, we have lupus and lupus doesn't have us. That's a great message. Thanks so much indeed, and carry on doing the warrior job And we'll be back after the break with more COVID-19 questions, rather, as we talk to a general practitioner to answer some of your questions. Stay with us. Welcome back. You're watching Health Talk. Let's get some callers on the line. Kalebogile is on the line. Thanks so much indeed for joining us. What do you want to say?
Hi, how are you?
We're great. How are you doing?
I'm okay under the circumstances. So I was diagnosed with lupus back in 2016. Mine is the lupus nephritis, the lupus of the kidney. So it's really been hard for me. You know, I've been struggling work-wise because I can't keep a job. You know, I have depression and anxiety. I have to go in for treatment. So it's a roller coaster. It's very, very, especially now because of COVID and because it's something that affects the immune system. So sometimes we have short breaks and so.
Have you been getting support and help from friends and also fellow loopers?
Well, yes, I do have one group that I was part of, but it's not close to Joburg. It's around Mafikeng. It's called the Lolo Lehwane Lupus Foundation. And I only started taking my treatment here at Baragwanath. So the support has been okay. You know, my family, my mom, and my brother, they've been supportive here at home. But, you know, the anxiety is the biggest problem for me at the moment.
All right. Well, we certainly wish you the best. And thanks very much indeed for calling and sharing your thoughts with us.
Okay, thank you.
Okay, that's Kalebogile. We now speak to Fani. Fani, thanks so much indeed for joining us. What are your thoughts today? Hello, Fani, can you hear me? All right, it looks like we've lost Fani, but we've got our regular doctor, GP, one of our regular commentators and who helps answer some of your COVID-19 related questions. And this is borne out by the fact that a lot of frustrated South Africans have been going onto social media to get advice and obviously sometimes not getting the best advice. So what we've done is gone to social media, got some of those questions, and then we're going to get you some proper advice. So we say good morning to Dr. Marylyn McKay. Great to have you as always.
Morning, Peter. Thanks for having me again.
Fantastic. All right, let's go straight to the questions. And the first one is... All right, it's coming. What's the first question? All right, here we go. Maria says, hello everyone. Anyone experiencing seizures? My brother-in-law started having symptoms of headaches and had 2 seizures since Friday. Tested negative for COVID, but we're pushing for a second test as we feel that he was tested prematurely before the seizures started. Okay, that's Maria. Marlyn, are seizures a symptom?
Not commonly. In fact, in my experience, I haven't had any cases of any presentations with seizures. We know headaches are a very common presentation, especially with fever and nose, blocked nose, congestion, sore throat. And of course, it's borne out now with the person saying, Maria saying that the test is negative. So yes, I would request probably a second test maybe later on. But it's unusual to have seizures related. Remember, COVID is by and large a respiratory illness, but there can be neurological issues with it. But for now, I wouldn't put COVID up there with the seizures.
All right, okay. Let's take a look at the second question that we have for you today. And does anyone else have swelling in their legs and feet and or major stomach bloating whilst fighting COVID? Marlyn?
Yeah, so again, these are not very, very common symptoms, but we've seen that COVID can do so many things that are not in the textbook, not in the literature, and the presentations can vary from person to person. Now, it can cause swelling. Remember, with COVID, you are tired, you are resting a lot, laying down, and there can be some fluid overload. That's why we don't want patients to drink too many liquids. So you can present with that. I would be very concerned about the involvement of the heart, Peter, because we can get cardiovascular involvement, damage to the heart muscle, which then can present with heart failure and can cause swelling of the legs, especially if there's shortness of breath, rapid heart rate, easy fatigability. So that is definitely a concern. The stomach bloatedness as well, not very common. We do see some diarrhea with COVID, but bloatedness with the feet could well point to a kidney problem or a liver problem or even a heart problem, as I've mentioned.
All right, okay, let's try and squeeze in one more question. Blanca Padron says, has anyone had problems with ringing in the ears? I'm so over this post-COVID. It's just really bad ringing, buzzing on both ears, and I'm getting dizzy. If anyone can help with advice, if they have had or having the same problem, thanks in advance. That's from Blanca.
Yes, so again, this falls under this whole issue of what we call post-acute COVID or long-haul COVID, where patients have recovered from COVID but are not better in terms of symptoms. And this particular symptom is called tinnitus, or the buzzing or zinging noises, ringing noise in the ear, together with a little bit of vertigo with the dizziness. Fortunately, there is help available. There are some medications that do assist with it, but we don't know how long it's going to last, when is it going to go away, can it get worse? And so the treatment is really supportive, and it's support groups, it's reading, it's researching, and having a doctor who is very, very supportive of you and not pushing you away just because we don't have that much information. But a good clinician will help you, and there is, as I said, some medications available that can ease those symptoms.
Let's take one more question. This last one from Carly Hall. It says, I'm about a month plus since I was diagnosed with COVID-19, and I was wondering if any of you guys' body just hurts so bad that you want to cry. Also, has anybody developed a cyst near lymph nodes?
Yeah, so the body aches and pains are not very common. We do get patients who complain of fatigue, so almost like a chronic fatigue syndrome, this myalgic encephalitis. But you can have very, very tender muscle points, reflex points that are quite sore. And again, I feel it for our patients because there's not much information. There's not many out there who are experiencing it. So research it, join some blogs, see who else is suffering with. But again, there is help available, but we don't know. We just don't know how long, what are the best medications to use. But we are there to support you, to get you through this. And hopefully those symptoms will resolve.
Dr. Marylyn McKay, always great chatting to you, and thanks so much for your advice. Thank you.
Thank you, Peter. Thanks for having me.
All right, that's Dr. Marylyn McKay, who's always there to help us unpack some of the concerns and issues that you have. And that's how we come to the end of today's edition of Health Talk. Thanks so much indeed for tuning in. And don't forget that the only way to manage this pandemic is if we all play safe, protect each other, stay at home, social distance, wash your hands, and of course, wear one of these as much as you can when you go out. Don't move around without one. Take care, have a great week, everybody, and be safe.